of introducing our commissioner, Commissioner Katie Marks, Dr. Katie Marks, I apologize. Commissioner doctor is kind of hard to say. I'm not really sure. We'll have to figure that out, right? She was appointed to the commissioner position in June of 2023. So she just missed Mental Health Month last year as commissioner, right? She just missed us. She is a assistant professor still at UK? No? Okay, so she was an assistant professor in behavioral science at UK. She actually used to lead the CORE, the Kentucky Opioid Response Effort here. So she has a large background in behavioral science and substance use, but now she's over all of DBHDID. So pretty honored to have her here. Thank you so much. I'll give the mic over.
Thank you so much. That was wonderful. I am going to take the liberty of rearranging just a second. Okay. And also, out of respect to all of my friends on my left, it is beautiful. Thank you.
Those are in the way. Yep.
I have enough challenges to overcome and people seeing me sometimes. Thank you for the introduction, Marcie. Here, I'll come.
You can take it off if you need to.
Actually, I like
Okay.
2 hands.
Cool. Yeah.
I do a lot of this and this. Looking around this room, it's just an honor to speak to you today because I speak to friends, I speak to colleagues, people that have taught me what the field needs to look like, and people that I feel that I've worked hand in hand to make change with. And so I'm honored to serve as your commissioner, but please see me as just one other person fighting this good fight alongside of you, and I carry my responsibility deeply of leading what we have in our Department for Behavioral Health, Developmental, and Intellectual Disabilities towards the brighter future that we all envision. I was so inspired by what we just heard in terms of the weight that we all carry and the patience we have to have sometimes, and the vision that we share. And I was reminded of something someone told me. I wasn't planning to share this, but I think it resonates so much about the long-standing work that we've had and continue to carry with us. And that was that someone told me it's, we say it's not a sprint, it's a marathon, right? Everyone likes to say that. And we're like, yeah, you're right. We gotta pace ourselves. We gotta keep going. I want to push it one step further because it's neither. It's not a sprint. It's not a marathon. It's a relay race. We are inheriting the progress of those that came before us, the challenges that were embedded by those that came before us, and we will pass it on to the next generation as well. Our wins, our progress. Our job is to become better ancestors for those that are waiting on the sidelines today. And so I just want to pass that along as another way of thinking about how we're all connected in this continuum, the story. Many of us are going to Eastern State Hospital's 200th anniversary soon, and just remembering the legacy that we carry and where we want to take it. Another analogy that I wanted to share is something I heard. Again, we just pass along the wisdom that we've received through our own lived experiences and those of others, was of a story that really resonates with me for envisioning what our future looks like. And I'm calling it the architect story. And if you've listened, you have to hear this podcast, Lost Patients. It's out there. It talks about the challenges of individuals with SMI churning through our facilities and back to the streets. Has anyone in the room? Wow, please. Okay, we're going to get it up from 2 to 20 by the end of this. But what they said is that we've created a system where we called, let's say, 14 architects into a room, and we said, we want you to build a house. We want you to build the absolute best house that you can imagine. And so each architect, you're going to design a room. You're going to make a bedroom, and it's going to be a thoughtful bedroom, and it's going to do exactly what you've designed it to do, be a nice place for you to sleep. And then you over here, you're going to design our kitchen, and then you'll do our living room, and I don't know, we can come up with all the other rooms of the house, and I don't know why there's 14 rooms, but it's a relatively large house. But so we had these architects each design a room that worked, and then we put the rooms together. And what we found is that they didn't work together necessarily. There were hallways that led to nowhere. There were staircases that only ended halfway up the stairs. There were doors that didn't open, and there weren't windows where we needed them to be. And that's what I think we experience in some way is the challenge of a fractured system where each of the individual parts is doing what it was designed to do, right? We're all working hard and thoughtfully on our pieces, but the bright future are those hallways and the doors and the interconnection between those. And we know exactly who can help us redesign that room and that house, and those are individuals with lived experience because they lived in the house. They can tell you what it felt like to not be able to get from one room to the other, and they can tell you what it should look like when we build it better. And so one of the things that I love about this group and the organization is the understanding of the value of peer support and lived experience, not just lived experience, right? Living experience, living expertise in shaping what our system looks like in the future. And so thank you all for that vision that you bring. Sometimes the larger system has fallen short of understanding what peer support looks like. They think that it's one individual supporting another, and it is that. But it's about allowing them to reframe everything we do, how we build our programs, how we run our organization, how our system operates. Brighter futures are ahead of us, but we also know that we're in a progressing state. And so I brought some numbers to share that are reasons for hope for me that we're already making so much progress. This came from an annual report that we produced in our department last year. But in what the Department for Behavioral Health, Developmental, and Intellectual Disabilities has funded just on its own, 152,000 individuals were served by our community mental health centers last year. 152,000. Thank you, because I know that you're represented strong in this room. 6,900 individuals were served in our facilities. We had 118,000 calls answered by our crisis lines. 98% of them were handled by call center staff on the phone. Wow, 98%. We saw a 5% reduction in fatal overdoses last year, and we are on track to exceed that this year. And we're making progress in prevention spaces as well. I don't know that we celebrate this or talk about this. Did you know in the past 10 years, we've seen a 79% reduction in youth tobacco use and a 50% decrease in alcohol use? That is the work that we're doing through our behavioral health safety net. Yeah. That is our future, and it looks different than it did 10 years ago. And over 3,000 peer support specialists trained last year alone. Yeah, there you go. Yeah, go on.
It's not your fault. It's the system.
Okay, I'm just gonna. Oh, that really does change things. I'm sure that's much better for you. That's far less comfortable for me. And just to push this, I should have said at the beginning of this, well, you heard, I'm a recovering academic. I love to give you a framework, a definition. You know I want to give you some data, and if I had a chart, I would throw it up there as well. And so I like to just kind of keep pushing these stories and these analogies. Those data points that I just gave you, that's not change, that's transformation, right? Change is something that just happens. It is inevitable. Transformation is the intentional decision to move in a different direction, and that's what those statistics hold for us. So let me share with you briefly about what our vision in the Department for Behavioral Health, Developmental, and Intellectual Disabilities, and you will hear me say the full name every time because every piece of our title matters. Let me talk a little bit about where our vision is going into the future. We finished a 2-year strategic plan just last month. And so I have a ton of ideas to share, and they're not new ideas, but they're focused in where we need to grow our system of care across a variety of domains. So that's what I want to do is kind of go through what those priorities are, and then I want to talk about them. We won't get to talk about them in this setting, but I want to talk about them with you. So our vision is simple. All Kentuckians have access to quality services and supports to live full and healthy lives. Simple. Yes. How do we do that? We promote health, well-being, and resilience for all. Those are three different things, and we have to promote all of them. We facilitate recovery for people affected by mental illness and substance use, and we support people with intellectual and other developmental disabilities. We do this through a set of values. Values are not platitudes. They are the blueprint for how we shape our system. And so what we came up with was the values that stand for co-create. I'm really proud that we came up with co-create. It used to just be create, now it's co-create, and I'm like, we really hit it. Okay, so collaboration. It is essential to all of our work. It is why when we each came into this room, we hugged our friends and we ran over to our neighbors, because that is how we change the system, is through our relationships. It is about supporting choice, that all people should have the fullest possible control over the decisions in their own lives, and respect for their decisions so that they can lead the meaningful lives that they've decided for themselves. Equity in the eradication of disparities so that all people have access to high quality services. Thank you. I love this. Advocacy, and I know that this group here really understands this value, but we have to elevate diverse voices, including those with lived experience, including families as well, to say this is what the vision of change looks like. We've got to be trauma informed. We know this. We have to be trauma informed throughout every level of our systems to build organizational resilience and excellence. We are called to be excellent in the work we do, in facilitating innovation, in empowering the individuals that work tirelessly in our systems, and are making data-driven decisions. Let's bring it in. That gives us 3 goals. We increase access to behavioral health and intellectual disability services. And access is really a complicated idea, right? It's not just does something exist in time and space. It's really kind of four dimensions. Does it exist? Is it available? Can I get to it? Can I access it? Because it can exist, but if I can't get there, it's not real functionally. And not just is it available and accessible, but is it acceptable? Is it what I need for my recovery journey? Because if once I get there, it's not what's going to meet my needs, I don't have access. And then if that service is not of quality, we've missed the mark. And so it sounds simple to say we're going to increase access, but we have to think about the dimensions. So quality is the second one. We underscore this independently because our department has a responsibility, particularly to the quality standards that ensures a system of care for our state. And so we take quality very seriously. And then reinforcing a resilient and inclusive and equitable organizational workforce culture. So moving forward, the way we thought about expanding or designing a strategic action plan was to think about 2 different ways. We have infrastructure initiatives, and then we have service delivery initiatives. And so the way I think about it is infrastructure cuts across all of the services we do. It's the values in action. And so I'm going to talk through what our infrastructure priorities are and then move into some specific service lines that are important. We have to start with equity, right? We know the data in Kentucky are painfully clear that we have an inequitable system of care, that certain people access certain services and that other people access a punitive system that was not designed for them. And so our responsibility is to disaggregate our data and see and shine light on those inequities. We know that we only start to have discussions about those once we can see the data, once we elevate that reality. And so equity is the first. So every initiative we have has equity. Quality, I'll say quality 6 times more in the next 15 minutes. Quality, especially in 3 pieces, is important for the department right now. Recovery housing. We have got to continue to build a safer, more conducive environment that supports long-term remission and recovery. The National Alliance of Recovery Residence Standards is going to be a requirement for every recovery residence operator on the SUD side, effective July 1, and we have got to ensure that our community meets that standard. We do so much work. They do so much work in their own lives to then be put in a place where it's unsafe or they're being taken advantage of. And so that NAR standard is really important. Quality in our waivers. is critical in enhancing the quality there. And then certifications, obviously, for our peers and our other leaders. Communication. So I'll just kind of recap these a couple times so you hear them. Equity, equality, communication. We have a responsibility to improve the transparency of our system, right? Navigating through our departmental website, navigating through how to find help is challenging in this state. And so communication is a huge priority of our department. I know you all have heard of, but I'm going to say it again. There were some really fantastic resources that launched in the last couple months. The Find Help Now Kentucky platform grew from just finding substance use disorder treatment to also finding mental health services and recovery housing and naloxone, the first of its kind naloxone, which is previously called Narcan, locator in the country. We have to take on financing. We have to take on how we fund a sustainable, viable system for our providers. And so my commitment is deep for our relationship with Medicaid, that we grow, because that is our engine, and that is how we sustain the system. And so I spend a lot of time in the financing space, and so does the team. Implementation practice. As a scientist, when I think about how change happens as a behavioral scientist, there is a scientific process by which that occurs, and the blueprint for that is something called implementation practice. It takes the science of how we gather people, how we discuss change, design it collaboratively, address the drivers of change, and then support the installment and sustainment of that over time. And so we're training our team in what implementation practice looks like, because that's what we do every day when we establish a new program or think about continuous quality improvement. Trauma and resilience, and embedding that in every level of our system and operations, that is a priority. Workforce innovation and development. I don't know if you've heard about it's called WID in my world of workforce, an innovation development collaborative, but we know practically everything is a workforce issue at the end of the day. And so having a comprehensive, thoughtful path forward and how we grow our workforce is vital. And I think Kentucky's actually leading the way in this. I shouldn't have said actually. Kentucky's leading the way in so many fronts. I have the opportunity to speak nationally regularly, and I am telling you, because of the relationships we've had and the time we've had to do this work, we are out in front. So thinking about workforce in kind of 5 domains. So again, researcher, let's understand our workforce needs. Let's look at our data to see where we need folks. And then what's obvious is we increase supply, right? Like we know that we need more people to do the work, but that's where we then also need to think really thoughtfully about addressing the distribution of those individuals and the reach of those individuals and retaining those. So when we kind of think about those 5 dimensions in parallel, we are empowered to understand what change can look like for our workforce capacity. So I'm going to transition. So imagine all of those infrastructure initiatives. It seems really simple when it's on paper. It's a challenge to speak about. Take all of those infrastructure initiatives and then apply them to these service priorities. These are areas that it's not a comprehensive list of everything our department is doing, but it's the things that are highly urgent, or that in some cases that have not received the attention it deserves, and it is time to elevate. And so I'll start with our work in the forensic space. I think that we've seen some really important legislation come out recently about growing our forensic quality and capacity and the diversity of settings in which we can offer these services. But there's 4 strategies that we're working towards increasing. So increasing community-based alternatives to some of our forensic services that have historically only operated within our hospitals or our Kentucky Correctional Psychiatric Hospital. Improving competency and criminal responsibility processes so that we are keeping people from languishing in jails when we can move them through the process faster. Developing community-based restoration. We know the value. The value is keep people in community. That is where we recover. That is where we get better. Bring them into community to do that. And then improving treatment services in jail. So forensics was our first. The second is behavioral health of children and transition age youth. You know, if I come to talk to you, if I come to your organization and sat down, that was the first thing I said, is we have a behavioral health crisis for our children and our transition age youth. And I know you all have been saying this far longer than I have There is momentum, there is capacity to fundamentally change the way we provide services to children, to partner with our child welfare agency and our Department for Juvenile Justice to reshape the system of care, an actual system of caring for these youth, and we're on the precipice of that. Thank you. We're changing the way we do crisis response, right? 988 has been just an absolute leap forward in our ability to have a statewide network of response and the ability to answer the phone. Our call rates continue to improve. The time to answer gets shorter and shorter. This 988 capacity is a game changer. When we look back at the history of the installation of 911, it was a 30-year process of installing the system, and a system that people were confident to call because they knew that help was on the other end of the line. We are doing that with 988. We are doing it faster, but we do have to be patient with that progress. And then building out mobile response and our ability to physically meet people where they're at in the community at the moment that they say they need it. Our developmental and intellectual disability system of care, waiver realignment, and access to waiver programs. I know there's so many people in this room that have fought hard and have voiced the need for that change, and I think we are doing the work now. I can't not have the Kentucky opioid response effort in here, as you heard. That was my first opportunity for service in the state. We've done so much in this space, elevating the role of harm reduction, of meeting people where they're at, of increasing access to medications for opioid use disorder, reducing the stigma associated with treating a medically based disorder as the medical condition that it is, reducing stigma for substance use disorders, for mental health. Unshame Kentucky, if you haven't followed that on your socials, Unshame KY, please check it out. I think it's a huge movement for our state. And investing in recovery support that we haven't been able to do with other funding sources like Medicaid. I'm so excited to be able to incorporate into every dialogue now discussions about employment first. We have been an employment first state for years, but I don't think it's received the attention that it needs. The recognition that individuals with physical and developmental and intellectual disabilities have the right and the expectation to be included in our workforce. That is a value of our state system, but we're not showing it in the numbers. There's a disproportionate lack of individuals with disabilities participating in our workforce, and we can change that. That's a solution for them, and it's a solution for our workforce crisis. So building a more fully inclusive workforce culture, creating positive disability culture, understanding and implementing universal design, and attracting employees with disabilities will change our system of care, just like people with lived experience with mental health conditions have changed our system of care. Suicide prevention, intervention, and postvention is a priority of our strategic plan. We're watching the numbers. We're seeing it grow. We see, especially in transition age youth and adolescents, that concerning change in trajectory. We also know we've got disparities. Older Kentuckians, Black Kentuckians, veterans facing higher rates of suicidality. And so our focus on increasing capacity for suicide, the three pieces, right? Prevention, intervention, and postvention are absolutely vital. Primary prevention. We cannot do this work thoughtfully and completely if we do not invest in primary prevention and embed primary prevention into our broader systems, right? When we have an individual who's accessing our treatment services, that is an opportunity to also be serving their family and their community with primary prevention services simultaneously, and training everyone to job share that responsibility of primary prevention. And then I'll finish, I didn't even get through the list, but I'll finish with housing continuum. We're good? All right, I'm going to circle back then. We know we could talk about for the rest of the day how structural determinants of health and social determinants of health are what stand in the way of recovery for so many individuals, and the housing continuum specifically as being the key critical moment of failure of our system to serve people in the community that they want to be in. And so we've got a lot of work to do, and it's important that the behavioral health space step into the housing space strongly and say this is what we need for our community. And so increasing the diversity of housing options for individuals, increasing capacity for community transitions to independent living for those who are coming back following institutionalization or at risk for institutionalization, housing that's capable of serving people with co-occurring disorders. If you have a substance use disorder and a mental health condition, you are not going to have an easy time finding housing in the state. We have got to build that housing too. That is a vital, vital area of growth. Thank you, thank you. Thank you. And what's really exciting is that Medicaid's coming on board for some of these ideas. They are going to lead some of the work with some of the new waivers they're writing for housing supports, but they're also going to do a pilot first in the country to say, okay, Centers for Medicaid, big federal Medicaid, we understand that you're still not allowing us to pay for housing, but what if we started paying for all of the services and supports that happen while you're in recovery housing? What if we created a system in which we could flow funds in that way? So maybe we're not paying for room and board, but we're for the first time going to try to use Medicaid dollars to pay for recovery housing, which will fundamentally change the face and the quality of housing that we have in the state. Okay, what did I skip? So now you're going to know what I skipped, and that's going to look good. They were all in a row, so they weren't picked out. Integrated care for at-risk individuals and integrating into primary care. We have spaces that people access, and they shouldn't have to go to multiple rooms or offices or be told to come back the next day to access the services and supports that they need. We have got to integrate our behavioral health care and our physical health care into one space. I've said Medicaid more than I expected to. We need our federal Medicaid partners to help support this, but we can also do a lot of work and make a lot of progress in Kentucky alone with the resources and tools that we have. That also is about having relationships with our medical system, with our primary care providers, our federally qualified health centers, and bringing them into the mix, having them have a table. Let's see a table of FQHCs in this room next year, or primary care providers, because they are a piece of this puzzle to solve. Two more: disaster preparedness and community response. You learned painfully through the floodings that we experienced and the tornadoes how rapidly we can lose our behavioral health systems, resources, and our community connections with a disaster. And so our ability to respond faster, to have the infrastructure ready for individuals is something we're deeply committed to. And I have to say, despite not being necessarily completely ready that first time, the community response was amazing. It was robust, it was thoughtful. Everyone got out of their houses, came over to their neighbors and started supporting. And so we want to just help that infrastructure, provide that funding to make sure we could do it even better next time. So I have just two more pieces for us. I want to wrap though by kind of bringing us all the way back. I know I gave you so much, and I want to come back to an architect story, right? These are all rooms. These are all rooms, and there's an architecture under them that supports those rooms. The beams are our values of equity and our values of quality. It is our responsibility to invite people, right, with lived experience and expertise back in as architects to redesign our system, to finish those hallways, to open those doors, and to build those windows. And that's how we get to the next level of brighter future. So with that, I would like to transition. It is an absolute honor to be able to recognize what our governor has made as a proclamation for Mental Health Month. We have a governor who really, really supports mental health and substance use. You hear it all the time in the speeches he delivers. We don't write those speeches for that. That is his heart he is giving to us. When he speaks about the value, importance of mental health and recovery from the substance use crisis, he is speaking from the heart. And so I just am honored to read these words to you in this proclamation that he has signed. So he says to Oh wow, this is some fancy language here. To all to whom these presents shall come. Mental health is essential to everyone's overall health and well-being. Mental health conditions are real and prevalent in our nation. Prevention is an effective way to reduce the burden of mental health conditions. And there is a strong body of research that supports specific tools that all Americans can use to better handle challenges and protect their health and well-being. And with early and effective treatment, individuals with mental health conditions can recover and lead full, productive lives. Don't we know it? And each business, school, government agency, healthcare provider, organization, and citizen shares the burden of mental health problems and has a responsibility to promote mental wellness and support prevention efforts. And so therefore, our governor, Andy Beshear, hereby proclaims May 2024 Mental Health Month.
Thank you. One more round of applause for Commissioner. Thank you so much. You know, I've been around this work for about 17 years myself, and I have to say I haven't heard a department that is so forward-looking, so change-minded, and that is so aligned with not just MHA's goals, but the goals of most of the folks in this room, I have to say. So I really appreciate that thought, that process, and I just want us to take a second to celebrate how far we have come, y'all. Isn't it amazing?